We have the final trip and trick, and it's a doctor that doesn't need any introduction, Dr. Cesar Guerrero. Welcome. Thank you.
Well, thank you very much. I'm really shocked with this show. Thank you, Stefan, for the invitation, and I'm really happy to be part of this. My idea that I want to bring is, I have my niece coming in, and uncle, you need to do my surgery. Well, you look good, honey. I think you look great. She's so pretty to me, and I decided to go ahead and do a level 1 osteotomy because she didn't like the gummy smile, and I advanced the chin a little bit, and I was happy. I was really happy, but she was very unhappy. Uncle, it's twisted, it's crooked. So this is she. Rose came to me and said, you gotta do something about my chin. I don't like it. I think something is crooked. So I started looking all the radiographs and all the patients that I've been using the bidirectional plate, and I found that there could be two problems. And one problem is on the left side that the inferior segment could be twisted a little bit. And even though I have something fixated in the middle, it was twisted, it's slightly open on the side. And the second possibility was that you can have a rotation because the device is in the middle and you can have this deviation, and because the incision is so small, you cannot see inside. So looking up so many patients, we decided to come up with an idea. And this is especially true when you needed to do major advancement. So on this lady, we did 12 millimeters of advancement with distraction osteogenesis, and we did another 12 millimeters on the chin. So on a 24 millimeter advancement, if you are going to the right a little bit, it goes a long way. So it's important that you are predictable and you got a stable result. So we came up with that idea. They went on top on the left. This is what I draw to the engineer, went to the software. Through the software, they found different designs, and finally, we got that particular plate that you can see on the screen, which is basically an extension on the side that I can go from the inferior border of the mandible, go through the plate into the symphyseal area. So again, this is the most common orthodontic surgery intervention that we do. And we gotta be predictable, and we gotta ensure stability after surgery. So with this plate, the idea is that you have a complete predictability. If you notice on the previous radiograph, there are some screws that goes from the inferior border to the symphyseal area. So doing that with this plate, we were able to treat patients for major advancements. You can see on this photograph on the bottom right that it was, again, about 20 millimeter advancement. And on this 20 millimeter advancement, we were able to get it straight on when we use a plate in the middle, and there were two screws that go from the inferior border to close the possible gap that we can have. So this new idea, this new method, gave us the opportunity to be predictable and obtain stability in our surgery. This plate is also applicable for the wing osteotomy. The wing osteotomy that it was developed by Sandner, rewritten by Triaca, and finally we did a paper for the JOMS in 2010. It goes all the way to the inferior border of the mandible to the posterior aspect, so we can move the whole base of the mandible. So when you have an asymmetry like this, you can fixate that with an extended plate and obtain that fixation. So I find this little variation, this modification, a change from a bidimensional, from 2 dimensions to a 3-dimensional plate. This is an evolution from a bidirectional to a 3-dimensional rigid fixation system. It saves money. I don't have to go back to the OR, as I have to do with my niece. I have to bring it back and fix that little inclination, and she's really happy after what I did. I always like to show my appreciation to the masters that we show, the yellow brick road that Susan McCormick was talking about, Professor Obegazer, and all my mentors that spend so much time for me trying to get some training into my head. Thank you very much. I appreciate it.
Thank you, Dr.
Thank you,
Guerrero.
Dr. Franco.
It's a nice-
Thank you very much. Thank you.
Thank you. So since this was the last tip and trick, I'd like to ask the jury to complete their votes and then present them to Dr. Deepak Krishnan. And then, last but certainly not least, we're proud to present Gabriella Millesi as the final That's It speaker of the night, representing Europe. There you go.
So, music and medicine, ladies and gentlemen. It was already in the Bible that we read about the first music therapy, when David was playing the harp for King Saul and cured his depressions. And in the ancient Greece, it was Plato, philosopher Plato, who was the pupil of Socrates. He found out that music and the rhythm has a direct path to our souls. So if we come to our century, to our times, we know that receptive music therapy is more on a scientific fundament. And we know from treatment of psychiatric diseases like depressions, anxiety, just think of your patients. If you have a patient waiting for surgery in your office, or Alzheimer's disease, maybe you have some dear in your family you cannot talk to, but it's amazing that they suddenly start singing old pop songs of their youth. So we know the advantage of music therapy and cerebral trauma. And in treatment of premature babies, we know that if they're exposed to cradle songs, that they gain weight easier than others. And if you think of stroke therapy, if you stroke patients, especially those that are affected by an insult in the speech tube, the Broca center, which is on the left hemisphere, that they are still able to sing songs because music is happening in both hemispheres. So we know that music is evoking emotions. And we know also from a scientific background, and the reason for that is the increased release of dopamine in the mesolimbic system. And it's the emotion, it's not only the well-being, but it's the emotion, it's a chill you get with the music. So who would not get a chill listening to the Requiem composed by Mozart shortly before his own death? And we know that this chill effect, that's created by an innervation of the sympathetic nervous system. It gives you the goosebumps, we all know. And that was the question for many people, human beings, before. It was also in the 18th century that the German neuroanatomist Gall came up with a new pseudoscience. He said, you know, he can identify, but by just observing the surface of a skull, where this human being has his or her quality in skills and traits. So, and there was a lot of enthusiasm about this new pseudoscience. And that was the same time when the musical genius Joseph Haydn was living. So Joseph Haydn was a respected musician in his time. He was employed by the Earl Esterhazy in Austria, and he was touring Europe. He was, as you know, in London, where he composed the London Symphony, and he was an idol also for Mozart and Beethoven, you have to know. And on the right side, when he died at an age of 77, his death mask was made. And now I come back to our specialty, oral and maxillofacial surgery. Look at that face. He had a deviation of the nose. And you know there's a history behind it. There's a medical history behind it. He was suffering from chronic sinusitis because due to polyposis of his nose. And there were 2 aggressive attempts by a military doctor to remove those polyposes. And by removing the polyposis, they resected also his septum. So he had this septum deviation. And now I come back to the pseudoscience of Gall. You know, when Joseph Haydn died during the Napoleon Wars, he had quite a modest funeral. And the secretary of Esterhazy, who was very enthusiastic about this pseudotherapy, cranioscopy, he opened his coffin and cut off the head of Joseph Haydn. And then the head was taken to a lab, to a secret lab, and they thought they could identify on that skull where that genius had his musical brain. So years later, when the Esterhazys wanted to give Haydn an honorable funeral, they found out that there was a corpse without a head. There was just the wig in place. So that became a crime case, and they really were looking for the head, and they found the head finally. So now we have gained a lot of knowledge about the brain and how music is working on the brain. For example, we know that in children, if they're performing actively music at an early age, up to the 7th year, they have an increased volume of the corpus callosum, which is the bridging of the 2 hemispheres. So there's a lot of knowledge here, but still, of course, there's mystery, and it will be riddles for many more generations to come. So till then, I can only suggest lean back and then just enjoy the beauty of music.